We are going to move on to, on your agenda, it's House Bill 5247 by Representative Amore. This bill has to do with the Uniform Controlled Substance Act, excluding chronic intractable pain from the definition of acute pain management, and it will prescribe new guidelines for treatment based upon the 2016 CDC guideline for prescribing opioids for chronic pain. We have written testimony from five entities. Everyone who has provided written testimony is in favor. We also have 3 people who are going to give us verbal testimony and virtual testimony. We're going to start with our first witness if we can. Okay. Hello, Claudia. Hello, Claudia. Everyone who has provided. Let's try now. Hello, Claudia.
Yes.
Yes, Claudia. This is Representative Casey from the House Health and Human Services Committee. I'm glad we finally caught you.
Hi there.
We are here with the committee virtually. I have you testifying on House Bill 5247. If you would please give us a brief overview. Representative Amore was unable to be here to introduce the bill, so I've just read the subject and summary. If you have some more descriptive terms for us, that would be appreciated. And I will give you a little bit of extra leeway if you're going to explain the contents of the bill. Go right ahead.
Thank you, Representative Casey, and thank you to members of the committee, most importantly to Rep. Amore. This is my 3rd year returning, speaking before this committee. I'm the founder of the Don't Punish Pain Rally organization and also the Doctor-Patient Forum. We advocate on behalf of patients and healthcare providers who have been negatively impacted due to the 2016 CDC opioid prescribing guidelines. I have over 20,000 members, and I have chapters in all 50 states. And I would like to offer that since I testified here the last time, New Hampshire has passed a version of this bill into law. As a person who's lived with severe Crohn's disease since I was a child, I'm certainly no stranger to pain, and I'm no stranger to how difficult it is, especially today, to get my pain treated, especially if I come out of remission. I was very sick at one point in my life. I was in Miriam Hospital for about 10 years, and I ran my court reporting agency from my hospital bed. I raised my children, and due to the severity of my illness, I was forced on disability. And that's the reason I created this organization. About 4 years ago, I was noticing how people with pain could no longer access pain medication due to the opioid crisis. And I think it's important for the members of this committee to understand that we advocate for people with painful, incurable diseases. These people have exhausted all non-opioid options, including nerve block, trigger point injections, spinal stimulators, gabapentin, antidepressants, acupuncture, physical therapy. The pendulum has swung, and people with severe pain cannot access medication. These people have cancer, sickle cell, multiple sclerosis, rheumatoid arthritis. They've had failed back surgeries. And for this community, opioids are the last resort, as they have exhausted all the other options. These people were cut off of their long-term opioid therapy overnight. They've been discriminated against at the pharmacy. Insurance carriers will no longer cover the cost of their medication, or they've been forced on a medication called Suboxone, which is used to treat addiction. These people do not struggle with addiction. Most of the people I advocate are 60 and older, a lot of elderly people, retired veterans. How bad is the suffering? It's pretty bad. In June of 2020, the AMA issued a 17-page letter to the CDC asking them to revise the guidelines to make significant revisions to protect patients with pain from the ongoing unintended consequences of the misapplication of the guidance. And probably about 3 months ago, a judge reached out to me. Her son has ALS, has Lou Gehrig's disease. He's 32. And the neurologist was no longer willing to prescribe both a benzodiazepine and an opioid. For a man, for anybody with ALS, they need access to these medications. These are very sick people we're dealing with. These people aren't running to the emergency room because they have a sprain. These people have painful, incurable diseases. And I have to really drive this point home because I've listened to all of the testimony prior to this regarding harm reduction. And the addictions community deserves to be treated with respect, and they should have access to medication. But the pain community deserves the same respect. And we've kind of been the lost, we are the forgotten victims of the opioid crisis. We did not create this crisis, yet we are being persecuted, disenfranchised. And as I sit back, I see so many people profiting off the opioid crisis while the elderly have been forgotten about. And I wanted to share one other story. A 79-year-old gentleman from Warwick, Rhode Island contacted me, and he was crying when he called me. He belongs to a pain management center, and for no reason, the doctor stopped prescribing. The only reason that was given is I'm afraid to prescribe. And this is a common theme with the doctors in Rhode Island. I've had several surgeons reach out to me, several oral surgeons, to let me know pharmacies will not fill their scripts because these are acute. It's acute as opposed to chronic. So that's another barrier, trying to get their medications filled. And I wanted to put it in perspective because there's so much focus on the opioid crisis. In the year 2018, there were 300,000 sepsis-related deaths. There were 7,000 oxycodone-related deaths. With all of the safety measures that have been put in place, illicit fentanyl overdoses are up by 1,042%. A mom reached out to me. She lost her teenager to an illicit fentanyl overdose. This girl was on American Idol 2 times. She was a semifinalist, and she had a horrible injury where she had 3 herniated discs, and the doctor refused to write her a script for a narcotic. And he said, I am not writing a script because of the opioid crisis. This poor kid was so desperate to get out of pain. A friend of hers offered what she thought was a Percocet. She went in her room, she took it, and she overdosed. And this is another aspect. We have people so desperate to get out of pain with these severe injuries, they will hit the black market, not so much, obviously, my elderly, because they don't know where to do this. But we're seeing people overdose because their pain is going untreated. I have been notified of partial amputations leaving hospital with only ibuprofen. So the pendulum has swung. This Bill 5247 will sanctify the doctor-patient relationship, which has been destroyed by these 2016 CDC guidelines. Most importantly, this bill costs the Rhode Island taxpayers $0. People are suffering. They're suffering alone. When you're battling cancer, the very last battle should have to be, will the pharmacist fill my script? Will the oncologist harass me? Will I be made to feel like a drug-seeking criminal? When you're sick, and I can tell you from firsthand experience, sometimes you just don't have the energy to advocate for yourself. So I urge you all to please support Bill 5247. I am needed in 49 other states, and I believe Rhode Island is the smallest state in the country, but I truly believe we have the biggest heart. So I thank you all for hearing me.
Thank you, Claudia, for your testimony. Are there any questions from the committee for Claudia? Thank you again, Claudia. We're going to move on to our next witness.
Thank you.
Hi, this is Representative Casey. Hello?
Yes,
Yes, who am I speaking with, please?
you are speaking to former Senator John Tassoni.
Hello, John. Thank you for appearing with us in the committee.
Thank you, Representative.
We are here today with House Bill 5247 by Representative Amore. We've just had Claudia Merandi giving her testimony. If you would like to add anything, we will give you some leeway for timing-wise, and if you do, if you would just like to keep everything to the point of the bill, that would be excellent. You have our attention, and you have the floor. Go right ahead, John.
Thank you, Mr. Chairman and members of the committee. I am the Vice President of the Substance Use Mental Health Leadership Council in Rhode Island. I represent 31 agencies in Rhode Island for mental health and substance use. And I'm going to tell you a personal story because Claudia Merandi did a great job explaining the bill. My dad, a few years ago, was in a hospital and the hospice center was full, so he had to pass in the hospital. He actually passed away like a fish out of water. They refused to give him the medication that he deserved to die in dignity. And I saw it firsthand. When you see your father in a bed, flopping around in so much pain, and we kept going to the doctors, asking them for more morphine to keep my father comfortable, they refused to do it because they were afraid. They were afraid of the consequences by the Department of Health, the DEA people, and a few others. Now, the pendulum, as Claudia says, has swung so far to the left that people are suffering. People should not suffer from pain. It could happen to any one of you on this committee that gets in a terrible car accident or breaks a leg, and when you leave the doctor's office or the hospital and they want to give you 3 days of pain pills and you are in excruciating pain, they're all afraid of giving you a refill. And that should not happen in the state of Rhode Island. That should not happen to any one of us who may need pain medication. So with that, Mr. Chairman and members of the committee, I'm in full support of 5247. In my heart, I'm doing it on my father's behalf. Thank you, Mr. Chairman.
Well, thank you so much, Senator Tassoni. Do you have any questions from the committee? Rep. Fogarty.
I do. Thank you. John, it's Representative Fogarty, and I knew your father. I'm very sorry to hear that is what he experienced at the end of his life. And I do agree with you that it did swing too far to the left. I think we tried to do the right thing a few years back, but you know, there are certainly some people who have these chronic type illnesses, or people like your father who should be able to die with dignity and get the morphine that we do have to address. So I just wanted to reach out to you and tell you I'm very sorry your dad went through that.
Thank you,
Thank you,
Representative Fogarty.
Thank you, Representative. I will tell you that the House was so gracious last year of passing this bill 74-0, and it died on the Senate side. I'm hoping that this year we can come together as a group and give the people who need pain medication the right to take it and the right to get it. So thank you very much.
Thank you, John, for your testimony. Are there any other questions? Okay, we'll move on to our next witness. Hello, Dr. Feldman.
We can come together as a group.
Hello, Dr. Feldman.
Yes, I'm here. Thank you.
Yes, hello. This is Representative Casey, Chairman of the House Health and Human Services Committee. We have you testifying on Representative Amore's bill, House Bill number 5247. If you would go right ahead, you have our attention and the floor.
Great. Thank you very much. My name is Dr. Arnold Feldman. I'm a retired physician with almost 4 decades of experience, anesthesiologist, pain specialist, spine surgeon, and now I work with Claudia in an outreach program, which I think she stated, called Don't Punish Pain, and she and the good Representative Amore have sponsored this bill. I listened to the entire conversation so far, and I pulled out some key words in the harm reduction bills that you spoke about, and these words also apply to all people, and they are dignity and empathy and compassion and care and legal protection. And listening to John Tassoni, who's a friend of mine, go through this with his father is just not how we as human beings, doctors, nurses, legislators, want our country and the state of Rhode Island to be. So I'll say in short, because I know you guys understand, doctors have been terrorized by these ridiculous CDC guidelines, which were ill-conceived. They've been repudiated by the AMA and even the CDC themselves. And we've heard testimony that death rates for opiates have increased despite a 50% reduction in legalized prescription writing. And what that means in reality is the problem is illicit fentanyl, not doctors and not patients abusing drugs. So regarding the CDC guidelines, all Claudia's bill and Representative Amore's bill asks the good people of Rhode Island to do is to re-sanctify the doctor-patient relationship, make it where the doctor doesn't feel like he or she has the sword of Damocles over their head every time they write a prescription, and to re-establish that Rhode Island, which I understand was started by Roger Williams because of intolerance in Massachusetts Bay Colony, should re-establish that tolerance for people, and you will be noticed. The world will notice this. So please pass Claudia's bill, and Linda, my wife who is here, who's also a chronic patient, we'll move to Rhode Island, and if that's a benefit, great. If it's not, I apologize in advance. So thank you very much for hearing John, Claudia, and we in the chronic pain community, we are also in support of the harm reduction community, in case anybody had the idea that those things were mutually exclusive. So the other thing I want to say is I will be in Rhode Island in May. If anybody needs a consultant, I will volunteer free of charge to help with codifying these things and implementing whatever you, ladies and gentlemen, decide to pass. And thank you very much.
Thank you, Dr. Feldman, for your testimony. Are there any questions for the doctor? Thank you very much, Doctor. We appreciate your testimony, and if you are in Rhode Island and you're available, please contact us through the committee, and I'd be happy to meet with you.
Great. Thank you again. Thank you so much, and God bless.
Thank you. Okay, so we're going to move on. That will complete the testimony for this bill.